it is 3:04 and we'll start our meeting. It's my understanding we have no appointments. Is that accurate, Chris?
That is correct.
Okay. New business. We have 4 septic plans requiring no action. Chris or Tom or Lynn, is there anything that any of you would like to discuss or bring up in any of those 4 septic plans?
Nope.
I do not.
Chris, do you have anything?
I do not.
Okay. All right, then we'll move on to the 1 septic plan requiring action at 109 Rockadundee, Margaret Carter. Chris, could you give us an overview of that, please?
Just a standard repair and just some waivers being requested on that. And just bear with me 1 second. So, it's been a very wet year, so they're looking for the sieve analysis and the reduction to groundwater. The property does have a lot of topography to it, but it has a lot of refusal or bedrock where there may be some lower elevations where they could have tried to relocate a system, but it was unsuitable material.
I had talked to Courtney about this. She had asked me a few questions. I think that's about as good as they're going to be able to do.
I agree.
Okay.
Lynn, do you have any questions or concerns about it?
I do not.
Motion to approve.
I will second that motion with the waivers of the sieve analysis and reduction from 4 feet to 3 feet.
Yep.
Any further discussion? All in favor? Oh, sorry.
Wait a minute. That automatically comes with a deed restriction, right, Chris?
Grant of restrictive covenant, correct. Limiting flow to the existing number of bedrooms.
Yep. Okay, so moved.
All right, any further discussion?
Nope.
All in favor? Aye.
Aye.
Any opposed? Thank you. All right, 3rd item under new business is the question of the face coverings during the COVID-19 time. Chris, do you want to give a quick overview of that?
So we're putting this on the agenda. We've seen, a lot of discussions in the news. Some residents have called about, seeing what some of the other communities have reportedly done elsewhere in the state, including Westport, New Bedford. I do know that Marion, I didn't read the article, but I did see a headline that Marion issued an advisory to utilize face coverings. We also know that the CDC issued, rather than a directive, as some towns have done and cities have done in Massachusetts, the CDC has, suggested. Also, Governor Baker has suggested. So we know that in Massachusetts, Governor Baker has been, out in the forefront of taking some preliminary actions ahead of, elsewhere in the nation. However, he at this time has still reserved the use of face coverings as a suggestion in Massachusetts, whether it be at an essential business or just as a worker or the public. But seeing how we've seen some discussions with the public on this, I figured I'd put it before the board for discussion.
I interject, Madam Chair?
Please do.
So I understand what people are trying to do, and I think it's probably more political. I hate to make that statement than anything else. I mean, Chris, you can't get done what you've got to get done now, let alone trying to enforce something that I'm not even sure is enforceable anyway. Would that be a fair statement?
Well,
You want me to weigh in on a little, Chris, on this?
Yeah, just on the enforcement aspect of it, because it's going to bring us into the mechanism by which we would, enforce is a section of the statute we have typically not talked about in public health in Massachusetts up until recently. So please.
Yeah, well, Chris's staff or your staff put together a spreadsheet listing different towns and municipalities that have issued orders and the basis upon which they issued the orders, if there were any at all. New Bedford issued an order with no legal basis whatsoever cited. Almost every citation used is inappropriate. For instance, towns have used, I think basically what happened is Brookline started this and other people started copying it. Some towns used 111, Chapter 111, 6 and 7, which apply to the Department of Public Health, not boards. Others used 111, 95 through 104 and 105 CMR 300. Now, 310 CMR 1105, that specifically relates to Title V inspections and enforcement relating to the environmental code. It's not applicable. Section 6 and 7 of Chapter 111 are not applicable to boards of health. Chapter 111, 122 has been cited. It does provide with some regulatory authority with respect to the source of nuisances, but that is not targeting particular locations of, it's targeting particular locations, business practices, or articles being brought into the municipality, like we have done in the past, as you know, with COM 97. That statute is not the targeting of persons and their activities as they move throughout the municipality. So that is an incorrect citation. The only potential citation upon which we could rely in issuing such an order would be Chapter 111, Section 104, and the statute reads in part, if a disease dangerous to the public health exists in a town, the Board of Health shall use all possible care to prevent the spread of the infection by such means as in their judgment may be the most effectual for common safety. And it obviously goes on, then provides for a fine of not more than $100. So even that is targeting the individual actor and not businesses. So even assuming we issued an order and we based it on Section 104, are you going to then go out and assign criminal fines to individuals who are not wearing the masks? I don't think that's the intent. And I don't think there's any mechanism in Section 104 by which a business would have its operation suspended or its license pulled for violating the board's order. So the enforcement issue, even if we could use that one citation as a basis for issuing an order, it's not really targeting what you're intending to target, which I assume would be telling certain businesses in the food industry you need to have your employees wear masks. And who is going to go out and then start issuing criminal citations against individuals who aren't wearing masks? I mean, the arbitrary numbers I've seen are when orders are for everybody to wear face masks, not just employees, have said for kids 2 years and up. And anybody who's had a 3-year-old or a 4-year-old is going to know it's going to be impossible to keep a mask on a kid. And then you're going to start issuing criminal citations to the parents of the children who take their masks off. I've spoken to counsel for other towns and municipalities who have issued these orders, and they basically admitted, I don't want to say out loud who they were or what towns they are, but they basically admitted, hey, this is, we don't intend to go out and enforce it. We're putting this out there so that we're relying on self-enforcement. And to paraphrase somebody else, it's almost a feel-good order.
Right.
So if I could, my feeling at this point is that it's really important that we pay attention to the example that Governor Baker and Mass DPH is setting. And my understanding is that on the 10th of this month, they issued an advisory regarding face coverings and cloth masks. And I feel like that covers the issues that people are concerned about. I don't see that we need to add to our responsibilities right now by adding an additional order. My feeling is Governor Baker's already issued an advisory, and let's just go with that.
I'm inclined to agree with that, Leslie. You've got CDC guidelines, you've got the governor's guidelines and the DPH's guidelines. I think that's the way to go. I don't think that we certainly, right now, Chris is overwhelmed with what he's got to do, and the staff. And you know, if we're going to be taking phone calls, who's in for? I just think it's you know, people need to just pay attention, listen to what DPH, what the state has said, what the federal government has said, and wear their masks until further notice.
Let me add to this too, that on April 15th, the Attorney General issued a guidance on local authority, and in one of, I'm trying to find it here, one of the questions they asked was, can a municipality require people to wear face coverings in public? The answer was a municipality can encourage people to wear face coverings in public on an advisory basis. Now, there's no citations to this, and certainly, you know, it is advisory. It's not, this isn't ruling on the towns in terms of whether we agree with this Attorney General's advisory, but they are saying, hey, look, we looked at this and we think that you can't step beyond what the governor has done and issue specific orders.
I mean, I think, if I may, Madam Chair, I think we could certainly, you know, on the website, on the town's website, put a bulletin up there or something that we encourage all residents to wear face masks when they go in public, like the governor has suggested, like the CDC has suggested, and like Mass DPH has suggested, and we encourage it wholeheartedly. I mean, I don't want people to get sick either, but I also don't want Chris getting sick or the rest of the staff, because they're exhausted. I mean, they're exhausted. Let's be real. They don't need something else to do for people who don't want to take care of themselves.
I agree. I think there has to be, if we could put on the town website a statement that says the Board of Health is putting out a strong advisory that face coverings be worn when going in public. However, I would also like to say that we are also encouraging those that don't need to go out, that they please continue the stay-at-home order that has been issued for the state of Massachusetts.
Yeah, I think that's a great idea, Lynn. I think we could do that, Chris, huh, fairly easily.
Absolutely.
I think I really do think that's the best way to go. I really, really do. For a lot of different reasons. I mean, God, you know, none of us want somebody else to get sick, but.
Well,
you know.
I also don't want to run on N95 masks or surgical masks that need to be reserved for our healthcare professionals.
Yep.
So I can foresee folks, if we make this a mandatory thing within town, going online, paying an exorbitant amount of money for something that should be going towards our healthcare professionals, and it's not really necessary, if you will. They should wear their cloth face coverings out in public, but by all means should stay home if they possibly can.
Yeah, I think that's a great, I really think that's the way to go. I really, really do. I mean, at this point, people I think are pretty smart. When I've been out in public, and I'll be honest with you, I've been out in public very much, maybe once a week to get some groceries, and I've been camped out here. You know, we make a list so that whoever's going out, they go out once and they get everything they need, and that's it. I think that people should be pretty much on board with this at this point. You know, I understand people's frustration. We're all frustrated, but you know, just for the sake of doing something that's politically correct and really, I think we follow the state's guidelines and federal guidelines, and I think we'll be in good shape. I really, really do.
Yep, I agree. Chris, are you okay with all this?
You know, we can easily get that posted to the website. You know, it would probably come out Monday morning with some of the stuff that we've got in queue, but it would be out no later than Monday.
Yeah.
We'd, you know, kind of see how we could kind of craft it together, you know, just kind of something catchy so that, you know, it can catch the attention of the public and, you know, stress, you know, the urgency of staying home. You know, social distancing really is, you know, it works, it's working. You know, that's one of the most important, you know, controls that we can implement and continue to implement with all of this going on.
All right, do you need a vote, Chris, on this, or is, the feeling of the board, as we've clearly indicated, we just need to support Governor Baker's advisory? Is that sufficient?
I think if you're going to, if you're going to make a statement of, strongly advised, then I would say that maybe a vote on that would probably be appropriate, so that if, we're going to put that on the website that the Board of Health strongly advises of, that it would be by a vote.
Okay, so moved.
Second.
Any further discussion? All in favor? Aye.
Aye.
Opposed? Okay, thank you. Chris, is there anything else on item C, like within this, that you'd like to talk about now?
That's it. It is limited to face coverings, discussion, and possible actions.
Okay.
So.
All right, sounds good. Next item is the reorganization of the board. Chris, I seem to remember in past years, we usually have like a list of everyone sort of within the health department, but is this item just for the three of us at this point?
Right. There was, the goal was I was going to kind of, do some policies as well on all of this, but, the work weeks have pretty much been entirely, COVID response on various actions. So I didn't get to get into all of those policies that we had talked about with, earlier in the year that we were going to try to do on an annual basis.
I don't know about you two guys, but I don't think that this is a necessity right now. We can certainly do this a little bit later, perhaps when we actually meet for real.
I was thinking after the election.
Huh?
I was thinking
after
after the election.
That's when we usually do it, and normally that would have already happened. But I don't think it's that. Why don't we let Chris, put those policies in and do it all in one shot?
Sounds great.
Okay.
Right? If you're okay with that, Leslie.
Yeah, absolutely. Sure.
You get to be chair for a little while longer. That's all.
No, I would really like to wait until the election too, Lynn. I think it's a good plan. Okay. All right, and the next item is 80 Slade's Corner Road. Chris, what's your recommendation on this?
Well, this gets back to kind of like the long-standing policy, which I was mentioning earlier, which we want to kind of just, if someone has a failed septic system and an addition is proposed, we've always had the policy of requiring the septic system installation prior to the addition construction. So in this instance here, the design is approved. The system installation has not begun. Permit, the owner has expressed why they cannot commence with the installation at this time, but would like to proceed with the addition. We have had issues with allowing additions prior to installation, where the addition happens and then the installation of the septic doesn't happen, and then we have to then enforce the failed system requirements to upgrade on the owner. It makes for very tense relations when the person, had previously agreed to and said this just works out, makes for a very efficient, opportunity for them. And, the two times we've bent the rules, the policy, I should say, it didn't play out the way the resident had promised us.
I don't think an addition is an emergency. So in my mind, I'm thinking that septic needs to come first. I really don't want to change our policy on this, given that even that we are in a pandemic. Again, I don't feel as though an addition is an emergency situation.
Tom, what do you think?
Well, I guess I'm a little bit of a softie because I did read her letter and it did sound very genuine. And I can, Chris is correct in that we've been burned a couple of times. One really nasty one where they got the select board members involved. Why are we enforcing this and all that kind of stuff? It was pretty ugly, as I recall, Chris, right?
Oh, yes. Yeah.
So while I'm sympathetic to the cause, if we let them go forward and sign up on the building permit for the addition, the only real leverage we would have, well, we'd have a couple things, right? I'm thinking out loud, Chris. We would hold up on their certificate of occupancy for that addition, right?
That would be an action that would be reserved for the building department, either through the building inspector or the building
Yes, so we have no
commissioner.
teeth
Yeah.
there. So the only
We
other,
could certainly request that, but, you know, he has certain actions that are driven through statute that we really can't interfere with.
right, we don't
And
sign off.
I'm not so certain on the occupancy. I know he's compelled to issue building permits within certain timeframes, but the occupancy I'm unsure of.
If they go forward with the addition and then they don't put the septic system in like they said they were going to, then we've got to go to court and force that, correct?
We could do a variety of enforcement mechanisms. We can pursue it through housing court because housing code requires compliance with Title V. So this would be a violation of Title V. So we could take the easy route through the housing court. We could do it through non-criminal citations. We could do it through both mechanisms. I know when I think that first issue that we had, probably, I don't know, 12 years ago, maybe 10 years ago. I don't know if we necessarily had the non-criminal citation mechanism then.
Yeah.
But it was
It's just a
ultimately the letter
hassle for
that,
staff, Tom. For staff to have to chase somebody, it's just another layer that could be avoided, in my opinion.
So what are you thinking, Tom? So you started off by saying you were feeling like you were being a softie about it. How are you feeling now?
I mean, if they're going to put an addition on, there's going to be an excavator there anyway, isn't there? One would think, Chris.
absolutely.
So why couldn't that excavator put the system in at the same time?
I'm not sure if they're using someone. I believe the owner is in maybe he might be in the contracting business, you know, with not so much like a full-blown home builder, but you know, he may be working with someone with small equipment for the addition that might not be a licensed septic system installer for the.
That's probably true.
It's a fairly small addition, so I would think they could probably do it with some sort of small equipment that typically installers don't have.
I mean, it's a shame that other people have ruined it for these people, but that's the reality of it, quite frankly, you know.
So Chris, I do have a question for you. You know, just in reading the letter, they say their installers, is in Portugal and is stranded. Is it not possible for them just to get a different installer?
Yep.
That's certainly, an option. I am familiar enough with that location, the person that purchased the home, and the type of business that person is in, that, that is his preferred contractor that they work with. So, I do know that, people get comfortable with contractors and, they can work with a licensed installer. And based on, what I know of that installer, yes, I do believe that he's probably in, Portugal and, with everything going on, unable to get back.
I mean, it would be my feeling at this point that we, say we need to stick with our regs and they need to get another installer.
Mm-hmm.
What do you
I guess
think,
the only
Tom?
thing I would offer as, the only thing that could differ this slightly would be as if there was an escrow account held by a third-party attorney, as you can, sometimes see with transfers of title. We don't see that a whole lot since the recession of 2008. We did see that a lot before then. So if the money was sitting in some sort of an escrow account held by a third-party attorney, as we used to customarily see and occasionally see now, then I would have assurances that would be more likely to happen and less likely to have the issues that we're afraid of.
What do you think, Tom and Lynn, at this point?
I'm okay with that, guys. If it's really imperative that they want to get going with this, get another installer. I don't know.
So I'd like to make a motion to deny the request.
Okay,
Do I have
I'll
a
second
second?
that.
Okay. Any further discussion?
Nope.
My feeling is that, they can get another installer. And I'm loath to ask our staff to monitor something else at this point. Their focus needs to be on the pandemic. And I just don't, I feel like, I'm sorry their installer isn't here, but as we know, there are lots of installers around. So that would be my 2 cents. So, all right, are we ready to vote? Okay, all in favor?
Aye.
Opposed? Okay. Thank you, guys. Okay, approving and accepting warrants for the bills payable. What do you need from us on that, Chris?
No action at this time.
Okay. We have no old business. And then the next item is minutes. We've got February minutes and March. I would like to throw out, Tom and Lynn, to you that perhaps we table this for now, and once we're actually back together, we can discuss them at some length, because I think, Lynn, as you very helpfully pointed out, there are a bunch of things that need to be fixed on both sets. So what do you guys think?
I sent him some, I sent you all my edits, so, and Lindsay has them as well, so maybe between now and the next time we meet, she can incorporate some of those edits into those minutes.
Tom, what do you think?
Yeah, I think that's a great idea. I can do this, if it's okay, I can do the same thing. Go through them, mark them up and send them to Leslie, yeah. Sorry, Leslie. Send it to Lindsay and she could do the same thing. And so that when we do get together, they'll be in pretty good shape, I think. I know one of the things I saw, I wasn't at the meeting and it got me voting on
that
stuff.
was one of my edits.
Yeah.
So yeah, they do need a little work.
Well, and a question I had for you both, Tom and Lynn, too, is, with the March minutes that are truly just a transcript, right? They're not really minutes, and I'm not sure what our options are in terms of being able to turn them into our regular formatted minutes as opposed to just being a transcript, because aren't those 2 separate documents?
Can you hear me?
Yes.
Hey,
Hi.
how are you?
Chris, I don't know if you want to comment on that, because I remember we discussed just getting it verbatim through Rev. So if you'd like me to type up some minutes from that, that's up to you, Chris.
I would love that.
Me too, because I think it went into, it's word for word, and sometimes we don't really need the likes or the ums in there.
We do have to maintain the transcript of it.
Yes.
So that is a requirement. So
could we just maintain the transcript and then ask Lindsay to just do up regular, our normal style minutes with votes that are clear and remove all the extraneous stuff, and then we just have a transcript and we have minutes? Is that a way we can go?
I'll have to go back to check the governor's orders on that.
Well, could we put on the could we put on the minutes that their transcript is available and where the transcript is available?
I know that is an option. I just want to make sure that, if we're creating like a minutes from that it's not I just got to check, because I believe that the transcript is going to be the official minutes. So, essentially summarizing that out would, I want to look at it further before I answer that, because I don't want to mislead the board, because this was done at a period before we had, there was an interim period right after when all these orders were coming out initially. Things were fast and furious, and then all of a sudden, we've kind of settled in. We've got the Zoom account now, and so
what does the select board do?
They are doing
recorded.
We're doing through DCTV. There was an initial time frame when you could meet by teleconference. Now we've got the Zoom capabilities, so we do not have to do the minutes do not have to be the full transcript.
Right. I was going to say, if there's a recording, there shouldn't have to be any written minutes, I wouldn't think.
It goes back to the governor's orders. It was very unique times, and these are still unique times. So just want to make sure we're in keeping with the orders. So
I agree. Yeah.
Okay.
Well, I'll start. Once you give me the go, I'll get going on that. if you give me the go.
Yeah, and I'll get you a copy of some of that stuff. There's just been so many emails. I should be able to find it quicker than I probably will, because, you know, the guidance was back in early March, probably several thousand emails ago.
Mhm. Sounds good.
All right, well, so why don't we table the minutes then for now and bring them up the next time we meet?
Yeah, I think that's a good idea. I really do.
Okay. All right. Let's see, meeting schedule. Chris, what are your thoughts about when to get together again?
Did we lose them?
So no, I'm just looking at a calendar, pulling a calendar up. So you know, right now we are looking at termination to the governor's orders on May 4th. However, I don't have any expectation that, you know, even if those orders were to lift in any capacity, that we should be, you know, meeting in a conventional method with, you know, close proximity anytime in early May. So, you know, with that being said, if we have a need to meet sometime in the first 2 weeks of May, then, you know, we'd have to meet in the same manner. So if we want to look at, you know, a conventional meeting, then, you know, we should be looking out further into May. But that might be a little too far out. So sometime I think between the, you know, these Friday afternoons are working, then we might want to look at the 15th or the 22nd.
Why don't you send out an email like a week before when you think you have an agenda or have,
We lost you.
Oh, you're back. Can you say that again, Lynn? Oh, she's frozen again.
So what I can do is, I think I understand what the message was. So what we can do is, in the first week of May, maybe around the 5th, we can send out some emails to the board members to let them know what is going on in terms of a projected meeting date, you know, on the 15th or the week thereafter. But it'd be
Yeah,
my expectation that would be by Zoom.
I think that's a good idea. You know, as things get, if something comes up in the meantime, Chris, you let us know and we'll put a meeting together if that's what we need to do.
Okay.
Yeah, exactly. I mean, doing a Zoom call like this is pretty straightforward. So, I mean, anytime you need us, Chris, we can do this, right, guys?
Yep.
Okay. All right. Discussion of any item not known 48 hours in advance. Anything we need to talk about?
Nothing of that nature that would allow us to discuss, no.
All right. I think we're ready to adjourn then.
motion to adjourn.
Second.
All in favor? Aye.
Bye.
All right. Thank you all very much. Stay safe.